Hey everyone, welcome back to the AABIP podcast. This is Martin Salguero from Memorial Sloan Kettering Cancer Center in New York. I'll be your host for this episode. Thank you all for joining us today. Today, we're going to talk about leveraging relationship within our own institutions for growing our IP or bronchoscopy programs. Today, we're very lucky to have Dr. Chinh Phan. Dr. Phan is the Associate Clinical Professor and Director of IP of UC Davis in Sacramento. Welcome, Chinh. Thank you for joining us today.
Thanks, Burton. I appreciate the opportunity. Just want to say thanks to AIBIP for having me on today to talk about this subject.
Great. Getting some formalities out of the way, do you have any conflicts of interest to disclose?
I am a consultant for Intuitive and Siemens.
Great. As a reminder, the views expressed on this podcast are those of the speaker and mine and not necessarily endorsed by the AIBIP. When all of us find ourselves in the position that we have to start a bronchoscopy or an IP program, and it's very challenging. We don't know where to start. We don't know how to do. And many of us sometimes lack mentors that even point to us the direction where we need to go. And when we get hired by an institution, the institution wants to see us succeed. They want to see us grow, and they want things to go in the direction that is going to benefit the patients and the institution. But we don't really know where to start and where should be the first people that we should talk to. So the first question that I had for you is, how do you initially identify and approach key individuals or groups that are really interested in seeing the program grow?
That's a great first question. So I would say you really want to identify the key stakeholders, strategic stakeholders that want to help you grow your IP program or your bronchoscopy program. I put into kind of three buckets. One is administrative. So who is in charge of peri-op or endoscopy or the OR? Mm-hmm. The CMO, usually the CMO, also CMO, so the chief medical officer or operating officer in line with administration to help you grow. Mm-hmm. And then the other bucket I think about is your department leadership. So that's usually your division chief, somebody that you report to, your boss. And then think about your physician allies, your groups, your other specialties that you work with. So thoracic oncology, thoracic surgery, med-onc. These are champions and collaborators that you want to learn, get to know them, have meetings with them. These are people you want to identify first with when you start your program, and then really create your vision or show them your vision of how you can grow together for your program and for the health system that you're working for.
Okay. And is it difficult to kind of start approaching them and start figuring out how to reach out to them? I'm guessing that, coming out as fellows, we don't know if these are doors that we can easily knock, or is there a hierarchy that we have to follow? How do we start building relationship with these people?
Yeah. So immediately, just when you interview the process, hopefully they interviewed you or were part of the interview process, and you got to sit with them and kind of connect with them. But if you haven't, then what I would do is when I first started is just who I reported to, my chief, and then kind of connect to talk to my chief and who are some of these key stakeholders and other parts, in administration and then in the physician group that I can just sit down with, connect with them just via email first when you first start off with. And you can look at the websites too as well. Mainly these people are on your institutional websites. Mm-hmm. And then what I would just shoot an email and saying, hey, I'm just starting here, and I just wanted to sit down with you and just talk about my goals for the IP program or bronchoscopy program, and then how we can align our goals together to grow together. And that usually starts the conversation. You kind of have to step outside your comfort zone to get comfortable at first, mm-hmm. And that's what I personally did. And then as those relationships mature and grow, and you get to know them and build trust and rapport, both parties can evolve and the program starts to take off.
Can you share some examples where you have had successful collaborations or partnerships that you built in your institution that have significantly benefited your program?
Yeah, absolutely. Being in interventional pulmonology, one of the hot topics today is like lung nodule management. How can we see these patients, sooner? How can we appropriately triage them? So we at UC Davis have a great collaboration with interventional radiology. Mm-hmm. As pulmonary, medicine, we kind of are the gatekeepers to these nodules. We see them. We know when we diagnose them, kind of who they need to see next to help expedite the referral process, especially when it comes to lung cancer diagnosis. So at UC Davis, we have a great collaboration where we set up a Teams chat group. And that gets kind of started naturally during COVID, where we were seeing these referrals, and we connected via Teams, and then it evolved to now where we still have a Teams communication where we get these outside referrals for lung nodules, and each of the subspecialties, either IP or IR, just says, hey, what do you think about this nodule, Chin? Hey, what do you think about this nodule, somebody from IR? And that way we see these patients a lot sooner. We said, hey, I can get this nodule a lot easier. It needs staging EBUS too as well. Just place a referral and we're able to streamline the patient's care. So that's been a great collaboration and partnership that has benefited both programs, because now IR can see the patients that they need to see and avoid some difficult biopsies. And then the IP program can help expedite these nodule management and workup and help the patients. Thoracic surgery, being in pulmonary medicine, pulmonology and thoracic surgery, they really need to partner together and work together, because we see these nodules, we diagnose them, especially early stage lung cancer. We help expedite the workup for early resection. And so getting to know the chief of thoracic surgery and their group there, and sitting down with them and helping them grow, because if your program grows, their robotic resections will grow too. And so we've got a beautiful collaboration with thoracic surgery here, where we help streamline early stage lung cancer diagnosis so we can get these patients to lung sparing surgery. So those are just two examples here that have really been successful partnerships at UC Davis.
So what I'm hearing from you, it makes a huge difference, not just saying the partners within your hospital as a specialty service, but as a name and a face, and knowing them, who they are, how to reach them, and having very direct lines of communication with everyone to try to streamline the care and becoming accessible for everyone.
Absolutely correct. It's just being accessible, available. That's something that you've probably heard about, as well in IP, like the 3A's, right? It's pretty apparent. It's apparent throughout. I think that the 3A's were coined by Dr. Wahidi, right? At Northwestern. It's been passed on generation to generation of all the IP physicians here. And it still holds up true to date, no matter what job I think you are at, whether it's healthcare related or not. So that direct line of communication is really helpful. And really think about when you're, Burton, when you're starting your program and you're graduating, you kind of have to think of your program as it's a brand. It really is. And somebody, or a few of you, whatever, who decides within your group to be kind of the face of the program, the brand of the program. And whenever they think about, hey, I need help with this, I got to think about, Burton, he's my guy. He's my go-to, or his team is my go-to. I can get to them easily. I can have communication with them directly. And that's really key.
Yeah, definitely. And moving on to a little bit of a different we already talked about, working with our team members, such as IR and thoracic surgery, but switching gears to a different group is, do you have any advice of communicating effectively the value of your program to the administrative stakeholders, not so much the physicians that can easily understand the value that we're providing to the institution?
Absolutely. So that's the other bucket, is you have to identify the key strategic stakeholders in the C-suite. That's really important. And what I did, honestly, is I just looked at your website. So if you Google your health system's website, they'll have it public. If they don't, you can ask for it within your department, your division. What are the health system's strategic goals? They usually release them every few years, and they want to streamline care, integrated health service, patient experience. And those are all things that we really want to do well in. That's why we went partly into medicine.
Yeah.
And so if you can have your mission statement, craft your vision to align with those things, hey, the IP program, we can get these patients quicker. We can reduce complication rates with our procedures, et cetera. That's what you want to share with the stakeholders. And then you're able to say, well, how are you able to do that? With this specific technology, with robotic bronchoscopy, right? We can get to more nodules. We can reduce the complications, et cetera. And those things you really want to highlight with the stakeholders. And it's important, I think it's really important, is when you first start off and people don't know you, is to set up those initial discovery meetings, just an introduction meeting. There's no ask in the meeting. All it is just introducing yourself as, I'm going to be joining here. I'm starting the program. I just wanted to meet you. These are my visions, et cetera. And then down the line, when you have a particular ask, right? Then they know you already, and then you can start those conversations, not from scratch.
Yeah, I've heard that before, and I think it clicked on me the moment I heard it from you hearing for the first time is uh, trying to identify and have a clear grasp of what is the vision and the mission of the administrative stakeholders, and trying to align your mission and vision with them in a sense that you both are providing the care that you want to give. I think that in the end, you end up talking in the same language. And I think that everyone wants the best for the patients and everyone wants the best for the hospitals. But when the language kind of aligns of both of us trying to want the same thing, is that things start to become more efficient and everyone gets invested in what you are offering, right?
Absolutely. And that language really begins with just alignment of the health system goals. No match up with your bronchoscopy or IP program goals too. Mm-hmm. They speak the same language. And when you start from there, then they know, hey, we're on a common path. Now, how we get to that path by certain metrics, that's another discussion too.
Yeah. And just talking about metrics with administration, I think it's a whole discussion on its own. But I think that we talked about the administrative part, but I think a very different one is someone that has less of a requirement of what they want to see from you, but more just wanting to hear about what you do, which is marketing and communications within the hospital. Can you tell us more a little bit about how the relationship with these teams help us raise awareness and visibility of our program, both within our own institution and with the community as well?
That's a great question, Burton. I think you really highlighted it well. Is how can we raise awareness so we can reach more patients internally within the walls of our hospital, mm-hmm. and also externally. And as a physician, or your group, you've got to be able to identify key people that can help you with outreach, because there's no way you can do everything by yourself. That's obvious.
Yeah.
So within a hospital, there are teams that want to help you grow and leverage your program. Mm-hmm. And at UC Davis, it's the public affairs and marketing team. And there's also the physician liaison referral team. And these teams are in other institutions as well, other health systems. You just have to be able to identify who those team members are. So one thing you can do is, when you start your job, your health system will release internet posts, new internal newsletters that you'll see highlighting stories within the department, other subspecialties. What I actually did was I just reached out to one of the authors within the department and said, hey, so-and-so, read your article. It was great. We have this new technology here. I kind of wanted to talk to you about it and sit down and can we see if we can also release a newsletter. Mm-hmm. And then once you get to know that person, or if they can't help you, they can identify somebody within their team that can help you translate what you want, on paper for a newsletter. Because that's helping promoting your team, your mm-hmm. program. So that's the position. That's the public affairs and marketing. Mm-hmm. And as you get to know them more and meet your senior staff, they can help you even further. So they can help you with social media outreach, right? Every health system has social media outreach, so they can help you put posts about your program too when you reach a certain milestone, or have a patient story that you want to share. Sharing patient stories are huge. Mm-hmm. They really help highlight, obviously, patient wins and success stories, but indirectly help to promote your program and the health system. So it's a win-win-win for everybody. They can help you also with when you have funds available. If there are funds available, you can think about outreach into the social media news outlets. Mm-hmm. So especially November is an important month for lung cancer awareness. Mm-hmm. So when November was near around the corner, I just reached out to them and say, hey, it's lung cancer awareness. I'm happy to participate in any outreach. And they can help set up with you with local news, so you can talk about lung cancer screening in your program. So that's another way that you can leverage or work with the public affairs and marketing to help grow your program. And then the other team is a physician liaison team. So what they do is they do outreach, community outreach for your program. So the first thing you want to do is obviously set up a meeting with them and just reach out to, if you don't know who they are, you can just either ask the public affairs and marketing team, say, hey, do you know who the physician liaison team, or just ask your own department who that person point of contact is, and just set up a meeting. They're not going to know anything that you do. Mm-hmm. So the initial meeting should be discovery, talk to them what IP or advanced bronchoscopy pulmonology is, especially what specific technology that you want to highlight. And then once they get to know you, then they can help craft maybe like a flyer that you can when they go out to PCPs or internal medicine or referring providers, they can give out to them, say, hey, this is the IP group here. Here's our contact number. And then I think what's really helpful, this is what I personally did, is during COVID, it was hard to have one-on-one meetings. And so anytime I had a referral from an outside provider that I didn't know, I looked up that name, I got the phone number and fax, the contact number, and I just sent an email to my contact from the public affairs and marketing team and said, hey, this is Dr. So-and-so. I just got a referral from them. Could you please set up like a lunch and learn online? So while they're having lunch, you can do a quick, 15 to 20 minute presentation on what the IP program can offer and your team and how they can get a direct contact. So I did that with every referring provider that I didn't know. And then even when the tail of COVID, even till now, present date, we're still doing that. And then you want to be able to do that with the local primary care network. So what's great about the public affairs and marketing team is they'll have a list of all the referring providers. And you can identify even other subspecialists too as well, med-onc, thoracic surgery outside of your network too. And they can do the same thing for you and set up either in-person or online outreach engagement.
Yeah, I think that the community also wants to see the same thing, and they want to see a face, they want to know a name, and they do want to know who they're sending the patients to. And I remember hearing once that a lot of community pulmonologists sometimes are afraid of sending their patients to an interventional pulmonologist for an assessment, biopsy, or procedure because they think that they're going to lose the patient because they're sending from one pulmonologist to another pulmonologist. And that comes from lack of knowledge of what our specialty is, what we offer, and the services that we provide. I think the moment I get that to know the specialty and that we're just helping them with this specific problem that needs to be addressed, it builds a relationship with them and it allows them to build that initial connection that is going to make all the difference in the world for getting all the future referrals and work from them.
Absolutely. Yeah. In order to, collaborate, you have to first just connect, with that referring provider. And you make a great point in just building that initial rapport with them. And you're not in any way trying to take away their business. You're just highlighting what you can offer, what type of services you can offer. And then it's up to them if they feel like these services are needed for the patient. And because a lot of these times they don't have those services available, these certain procedures that we can offer them. And then once that initial, and I would say the most important referral is the first one.
Yeah,
it is. Like you've heard that before. It is for common sense, right? Because that sets the foundation for every other referral that's going to come your way. So when you get that first referral, you acknowledge it. Hey, I got the referral. We'll help expedite it. After the procedure's done, if I got a procedure done, text them back, email them back, call them back, saying this is what the outcome of it is. And that sets the expectation now for your program for all the other referrals. And that builds that trust and helps grow your program.
Yeah, someone told me once that first referral needs to get the red carpet. It really needs to make sure that everything is pristine and everything goes well, because that's going to be your introduction card for that provider.
Yeah, it really is. For any patient that you see, you really want to, we work within the health system. We know how the health system works, the nuances of it. And so if you can give that red carpet kind of treatment for your referring provider with every patient that you see, it's going to really help your program organically, because patients will look you up. And that's another thing, metric that we're judged upon, right? Is that patient satisfaction score. So your health system will have a satisfaction score for you that is publicly available. You rank on a 5-star, system. Yeah. And patients will look you up and be like, I would rather see Burton because he's got 4.9 stars. These reviews look great. And so every encounter, you really want to do your best to give that treatment, that like you said, red carpet.
Definitely. And once you establish this relationship with community physicians, you already threw the red carpet, they already know you. But once you have had that relationship for a couple of years, how do you build and maintain that relationship and you make sure that the relationship is not getting lost.
Yeah. So you got to think about it like every year, almost as your program is like a company, right? There's certain KPIs or key performance indicators that you want to look at. Those things you want to track. And so when it comes to just maintaining the relationships and with those community physicians, they will forget about you. They will, because we're all siloed into what we do. There's no way you're going to remember what everybody does, because we're all focused on what we do and we're really trying to do it well. So some things that you can do is, one, if you're engaged in local meetings, right? If you see them, just remind them, hey, it was great seeing you. Thanks for sending that patient. When you're having these lunch and learn meetings, sometimes like if you've had an online, maybe next year touch base with the public affairs and marketing team again and say, hey, I'd be happy to come to their health system and do a grand rounds. I'd be happy to come to their office this time and meet their other providers if if they're growing their group, and sit down with them personally and do another kind of lunch and learn. And you can even offer too, is if you are kind of a center of excellence for robotic bronchoscopy or fluoroscopy, et cetera, and they're wanting to establish that and grow that, you can say, hey, if you want to anytime check out my shop, you can check out a case too as well. There's an opportunity too that you can provide some educational and value. So those are things that you kind of have to keep engaging. And what's great about the public affairs and marketing team is they keep track of this for you. They keep track of what providers are referring, kind of the volume for you. So you kind of look back and say, okay, what encatchment areas do I need to focus on more to try to help grow that patient population?
And talking about, the same thing, which is how we measure and pay attention to that data. How do you really measure overall the impact of all of these relationship building efforts on the growth and success of your program? Is it how much your program is growing, the volume of procedures, the number of referrals? What are the things that you recommend that we should be looking at to see that these efforts are actually bringing something to us?
So the answer is all the above. So, what you exactly mentioned. So you got to look at your referral volume. So try to identify somebody that can help you with this, so you don't have to manually do this yourself. And that's either your division practice manager, your clinic manager, perioperative manager. What they can do is, especially when you first start, Burton, is that you want to say, hey, I want to be able to look at some metrics so we can quantify how well we're doing. We're growing the program. So that's clinic volume. That's new referral volume. That could be from the time you get referral to the time the patient sees. These are certain important quality metrics or quantitative metrics. And then you want to look at, downstream of those referrals, what's the procedure volume from year to year or quarter to quarter? How much block time, how much anesthesia time is your group using per quarter and then annually? And then you can break it down to what type of procedures, et cetera. And then when it comes down to specific, procedure outcomes, like robotic bronchoscopy, what's my yield, complication, et cetera. And then what's harder to quantify, and we're still trying to quantify that here, is what's the downstream impact. So you need to look at, talk with your billers too as well. When you first get to your program or you're starting your program, and just now, even today, right? I'm doing it as well, is having a meeting with the billers and saying, are you billing accurately? How can we capture downstream billing or revenue? And once you identify these key people that can help you, then you can get these reports kind of automated. So then when you meet with C-suite or meet with your service line managers or meet with administration, your division chief, you can show them the growth in terms of with numbers and quantitative. Okay, this is what we've been doing compared to last year, et cetera. And now we're at the tipping point where we may need more help in terms of FTE, in terms of equipment, et cetera.
Okay. Wow, this all has been fantastic, Jim. Thank you so much for everything and for all the so many tips and advices that you have given us. I think we're running out of time. Any other closing remarks that you want to say?
Thanks so much, Brent, for the opportunity to talk about leveraging partnerships and stakeholders and just identifying key clinical champions within your health system. I think that's really something I've learned along the way. I'm still learning, and I can tell you I'm glad I did it. because there's no way I would be able to help grow the program without the people that I work with.
Yeah, it definitely takes a village, and this is definitely something that when you're starting a program from scratch, you're not going to be able to do on your own. And even if you're not starting one from scratch and you're joining one that is growing, there's always room to grow because we see it on our day-to-day practice. There's so many people out there that need our help, and all that we need is just the community effort of making things happen for everyone. Okay,
Well said.
thank you so much for everything, and thank you again for joining us today.
Take care.